Welcome, everybody. Happy New Year. Can't believe we're in 2024 already. But thank you for joining us on this Talk Tuesday today, January 9th. We are so happy that you're with us to learn some content and get some information and some strategies that can hopefully be beneficial to you, your school, your districts, and your organization. I'm Kristen Killand. I'm a consultant at CERC. I welcome you into the space. And I am here with my colleagues. Although today Stephen and Elisa couldn't join us, Anne-Marie Credisco is in the space as well. And we are so happy that you are here. We are also here with our CSDE partners, Kari Sullivan-Custer and Jay Brown. Today we have a really great presentation with the Mobile Crisis and Urgent Crisis Centers. We have Stephanie Bozak, who's the Behavioral Health Clinical Manager of Children's Mental Health at the Department of Children and Families. Also, Rosa Baldino is with us, licensed clinical social worker, project coordinator at Wellness Behavioral Health, and Brittni, Lourenco, clinical supervisor at Mobile Crisis. Thank you for joining us, and I'll introduce them along the way as well. I will wrap up our session for today just on some upcoming attendance and engagement meetings and information. We always do some quick Superintendent's Digest info of kind of the newest things that are posted, resources, information, things you might find interesting. We will also send the slides out, so if something really you see that you want to dive into a little bit more, you can just click the link or the QR code that is embedded onto the page. Just kind of going through the list, I always like to point out things that really pertain to attendance and engagement. So really looking at, CSDE launched the School is Better With You campaign, which Kari will go into in just a little bit more to kind of give you a little bit broader information about what that's about. We have the profile and performance reports out, and we have, there is some certification alerts I did want to point out with some cross endorsement requirements out there, especially looking at the components of different things that relate, especially to different roles within the schools. There is a webinar registration for social, emotional, and intellectual habits. It looks really interesting. You might want to look into. It looks like there is a session tomorrow and the 17th. And we have some Department of Children and Families mandated trainings kind of coming up. Another great resource to look into. Also, CSDE launches their K-2 science model curricula. And then January 8th, what we put out about the virtual one-on-one trainings, we still have some more trainings into January. So if you're interested in the 101, it's free. Just register and join. The other thing we wanted to point out to you is we are looking for more registrations for our high school affinity groups. It's a really awesome cohort. We're talking on January 25th about student voice and belonging. It is a 2-hour session, and it will include specific resources aligned to the bright spots, improving high school attendance in Connecticut. It also will have a student voice panel with students on their experiences, and there is this perceived sense of belonging and connectedness in the high school that will be connected with it. If you already registered for this, you do not need to register again, but we are going to put the link into the chat box for you in just a little bit. So please feel free to register. It is an in-person event, but we would love for you to join us. Any registration information, I have Holly's email at the bottom. And for any content-specific questions, Anne-Marie Credisco is coordinating that as well. So please feel free to join us. We'd love to have you as part of the conversation. And the students we're bringing in are really fantastic with a lot of insight to bring. And now I'm going to turn it over to Kari Sullivan-Custer.
Good morning, everyone. How's everyone doing? Happy New Year. So great to see everyone. I hope attendance is going okay. It's been a rough month with respiratory illnesses, so we anticipate that has been difficult for folks. I wanted to share some data to start. I did a little deeper dive than I usually do, but we have the year-to-date for November. November's chronic absence rate was 19% for the state, which was up a titch, just a little bit from October, which was 18.7. But the good news about that is last year, November, we got hit really hard with respiratory illnesses, and we were over 25% last November. So this November, we're at 19%. And so I'm excited to say we're still going in the right direction. We anticipate, seeing upticks in chronic absence in, December and January, but the work that everyone is doing is paying off. We know everyone's working hard. Our school attendance teams are meeting. We're looking at our data. We're bringing in partners like the mental health providers that we're going to listen to today and helping all of our students come to school. So this report is issued every month. And along with it, there are spreadsheets that you can download that has both your school data and your district data by student grade, by students with disabilities, by just about any grouping you can think of. And so you can download all of your schools and all of your districts and compare to where you are with other districts. So for all students, like I said, it was 19% for November compared to 20% the end of last year. We're still lower than we were at the end of last year. And you can see in these bars going back to the last several years, with the gray bar being the first year of the pandemic. When we ended in March, we were at 12.2. We're still pretty far from where we were, and we have a lot of work to do. Students with high needs is our group with the largest proportion of students, 66,571 students with high needs were chronically absent in November. This group here, if you remember from our last talk Tuesday, we called out our students without high needs. These are the students who are not free lunch, do not have an IEP, and are not English learners. Their chronic absence rate is going in the wrong direction. You see here it is at 11.8, where at the end of last year it was at 10.2. You can see all of these other student groups are coming down. And this is a group of students who were not chronically absent before the pandemic. So something's happening here that's impacting our chronic absence. And that, even though it's at 11.8, it's still 27,000 students who are chronically absent. That's a pretty large group of students. If you look at, compared to our English learners, there's 12,000 who are chronically absent. And our students with disabilities, that's 22,879. This used to be a group we didn't pay any attention to. And I call on you now to look at this group of your students and to see who are those kids who are not coming back to school, who were regular attendance before, and what is happening? What's the root cause? What's the story behind those absences? Is it school avoidance? Is there some mental health or depression issues happening? Do we need to do an assessment on those students? But these are probably kids that may be a little bit easier to bring back to school. There may be some misperceptions after being home for so much time before the pandemic about, we don't need to go to school as much. We didn't before, or there may be some malaise about going to school. Mom might be working at home, so it's easier to stay home. But I just want to call that to your attention and I look at this in a different view as far as sort of the size of the groups of the students who are missing the most school. You'll see for kids with free meal eligible, there's 50,000 kids chronically absent. Whereas at the bottom here, I can't see it because my computer's on my, but for kids who are not free meal eligible, 35,000 of those kids are chronically absent. That's closing the difference. That is a very high number for that group of kids. And then you'll see for students experiencing homelessness, there's a little over 1,100 kids. I also put here because it's not part of the monthly posting, but if you look at students by race ethnicity, you'll see the size of the groups of, there's 14,000 Black or African American students who are chronically absent in November, 39,000 Hispanic Latino, and 32,000 white. And so it's nice to look at it as the proportion of that group, how many are chronically absent, and compare that way. But let's also look at who are these kids and what is the size of that group. Anybody have any questions about that? Has anybody done this at their district and had some aha moments or anything they want to share about that?
Hi, Carrie. Hi, how are you? Quick question, and I'm sorry if I missed this. For the students with high needs, who was included in that population again?
There's three groups of students that are included, and this started with our accountability system. It's part of your accountability report, the students with high needs and students without high needs. High needs students grouped together students with disabilities, so students with an IEP, English learners, and free meals.
Got
So
it.
you've got poverty, special education, and language. And so that provides, so districts get a chronic absence rate for their full district. And then they also get one for their high needs students, because we found that before we did this, districts would think, oh, I have a great chronic absence rate. But then if you dig deeper and you look at these groups of students where the N might be a little bit small, you'll find that you may not have a great chronic absence rate for all your students. So it kind of helps with the equity lens.
Thank you.
You're welcome. One other way I looked at the data for today, if we could go to the next slide, I haven't done this before either, is by grade level. And you'll see we still have our Nike swoop, and many of us will recognize this. So the blue bars are the student count by grade level. So you'll see we have a little bit more for grade 2 is a little larger, and that might have something to do with COVID. And 9th grade is a little bit higher, but the red line is their chronic absence rate by grade level. And you'll see kindergarten and high school. Again, I encourage you to really look at those grade levels and see like what's happening to bring our chronic absence down in our 4th, 5th, and 6th grade. And why is it so high in the high school? And you can take this QR code, and that will bring you to these monthly data reports, year-to-date reports. So you can see the latest is November. You can see November data. And then on EdSite, you can see, I think it goes back 7 or 8 years of data for your district and your schools. So that is that. Next slide. All right, this went out to all superintendents yesterday, and registration has been really busy. So I want to make sure everyone knows that the LEAP 101 virtual trainings, there's 2 this month, January 17th and January 29th. We've been holding them 1 or 2 monthly since I think May. These are the last 2 that are scheduled. So we want to make sure that everyone who wants to take LEAP training knows these are the last 2. In January, we will schedule more in the future, but it won't be right away. So if you have people you want trained, please sign up for January 17th or January 19th. And this flyer is on that in the LEAP page, which you see there. Next slide, please. So I want to just remind you guys of the School is Better With You attendance awareness campaign. There's a toolkit of this. How many people have seen this on social media? Has anyone seen the ads on social media? You know, every time I go on, I must be one of their
I heard it on the
demographics.
news also.
Yeah, you heard it
on
on
Bomba
the news.
Radio on the Spanish station. I heard it this morning. It was awesome. It was really good to hear.
Excellent.
Yep.
That's excellent. And so there's a lot going on that someone's not on a bus. That's great. There's billboards in Hartford, New Haven, Bridgeport. There's small roadside billboards out in Windham County. But there's materials for districts. There's a toolkit on this website where you can go in and download. There's tips for messaging in the morning for kids. There's a sample email to send to families. There's a newsletter article that you can use. There's lots. There's when is sick too sick to come to school flyer that it's in English and Spanish. Many of these are in translated, and so I encourage you to use this. And even more importantly, I'm going to introduce Caroline Calhoun. EdAdvance is our partner with this, and she's going to tell you about the gifts that's coming for all districts this month.
Thank you, Kari. Good morning, everyone. As Kari mentioned, my name is Caroline Calhoun. I am a professional learning and attendance specialist at EdAdvance. We are the RESC up in the northwest corner of the state. Very snowy up here for those of you not in this corner of the state. It's very wintry and beautiful. By the end of the month, in partnership with SDE, we are going to be offering all school districts free of charge what we're calling sort of an attendance awareness starter toolkit for you. So that is going to consist of banners that include messaging supporting the campaign. It also includes stickers with visuals to support the same messaging. And then what we're calling sort of little stress fidget balls, push and pop balls that are kid friendly. So thinking about that messaging getting out to kids as well with the slogan, "School is better with you." So I'm envisioning things like lunch bunches and kids who are maybe experiencing any kind of anxiety being able to use those. So we are orchestrating with the RESCs right now to use those as delivery hubs, distribution hubs across the state. So stay tuned. There will be a lot more information coming about how you will be able to access those starter kits and picking them up at the RESCs. The other piece of this is that we are going to be launching a pop-up web store with additional branded merch that is also part of this campaign that really promotes this positive attendance messaging. And those items on the launched pop-up store will be available for purchase by districts, so that you will be able to choose anything that might be helpful for you with staff, families, students. So think things like umbrellas or vests, or think about things like tote bags. There's a whole variety of things, pens, pencils, stationery, paper goods, so a whole variety of things. And we really hope that this effort, as you're mentioning, you're seeing the bus ads, you're seeing the billboards, you're hearing the radio spots, all of this is really complementary so that we're getting this messaging out to the entire state. So we're very excited about it, and feel free to reach out to me with any questions. I can pop my email in the chat, but we look forward to getting everything into your hands.
Yes, and we're creating enough banners so that almost every school can have a banner. You can put them in your library or your youth service center or your town hall, and you can create sort of this blitz of the campaign right in your own community. So this isn't just a state level campaign. We can use it in your district. And it's School is Better with You. We listen to families, and we are taking too much time. I have to hurry up, but we listen to families and about why they're missing school and what they would like to at school. And we want people to know that school is better with you, that we miss you when you're not here, and that it's the change in the messaging from you're bad because you're not in school, whereas we appreciate you when you're in school, we miss you when you're not, and changing that whole relationship with families and students. So this is going to be available, and there's a video that we're going to be launching too that you'll see on TV. And I think we're going to show it really quick. Am I showing it? Oh, okay.
We're going to see. You might have to share it because now Google is not sharing for me. Sorry about that.
Okay. Let me see.
It's not even.
I have it ready to go here. There. Can you see that? And then
Yeah, we can, yes. What in the sound just has to be.
Did I not do the audio part?
I do not hear the audio.
I know I'm going to do that. Let me stop sharing. Uh-oh. And stop the share. Okay, stop share. Sorry guys, I'm not gonna get upset because this stuff happened.
It's okay. Thank you, Kari. And I'm trying to reload.
And here's this. And here it is. And now it's gonna work.
Yep. Sounds good.
School's better with you here. And when kids come to school every day, they set themselves up for success now and in the future. Missing even 2 days of school a month puts a child on their way to chronic absenteeism. So send your child to school every day. Students enjoy good friends, good times, great teachers, and support when they're at school. Visit ct.gov/betterwithyou to learn more. That's ct.gov/betterwithyou.
What do you think, guys? You like it? I see you, Mike. I see you. Thank you. Awesome. So that's going to be launching soon. So you will probably see that on your TV. And I'm not sure whatever OTT means. Carolyn, what's OTT? Over something.
Oh, that's too technical for me, Kari. I don't know.
Yeah. So there you go. And you can also use this. We're going to share it in the toolkit, and you can put it on your website. You can send it out to families. So really use it. Next slide, please. And then don't miss Talk Tuesday. We have them all up on our website. We've had some great conversations. Family engagement, supporting multilingual and immigrant families, building school love with mentoring. If you missed any of these, they're fantastic. And so the videos and the slides are on our website. You can go through it with this QR code or this link here. And with that, I'm going to turn it back over to Christine. Thanks, Christine.
Thank you again. And I'd like to introduce our featured speakers for today. And we have Stephanie Bozak, again, Behavioral Health Clinical Manager of Children's Mental Health at Department of Children and Families. We have Rosa Baldino, Licensed Clinical Social Worker, Project Coordinator, Wellness, Behavioral Health, and Brittni, Lourenco, Clinical Supervisor at Mobile Crisis. We also were supposed to have Cathi Newman join us today from Waterbury Public Schools, and unfortunately she couldn't due to some scheduling and with the, I believe, some bad weather on the way. So hopefully we could have her join us or somebody else in the next round of this, but we would like to introduce Stephanie, Rosa, and Brittni.
Thank you so much for having us. I am delighted to be here. As Christine said, I am from DCF. I oversee the Children's Mental Health Unit here at DCF, which many people don't even know that we have, which is a larger part of the division of community mental health or behavioral health, which is inclusive of the work around substance use, interpersonal violence, as well as the children's mental health. So we wanted to come today and talk a little bit about the resources available for schools, mobile crisis and urgent crisis centers. And I'm going to turn it over to Rosa and Brittni, who's going to talk a little bit about mobile crisis, and then I'll talk a little bit about urgent crisis centers as we continue. Rosa and
Hi everyone, I'm Rosa Baldino. Happy New Year. So glad to be here and hopefully share some information with you all that might be helpful to you. I'm joined by Brittni Lourenco, who is one of our supervisors at Mobile Crisis. Both her and I have been with the program for many, many years. We both actually started as interns, and we just love the work. So we're excited to share this information with you today. We can go to the next slide. So Mobile Crisis Intervention Services used to be known as Emergency Mobile Psychiatric Services. It's the same service, we've just changed our name, and it is a statewide program available through the state of Connecticut. It's a community-based and family-supportive clinical intervention service for children and adolescents experiencing a behavioral or mental health crisis. It's a rapid emergency crisis stabilization with short-term follow-up care and connection to other services. We are available to respond to wherever the child is as long as it's safe for us to do so, 24 hours a day, 7 days a week. We recently have gone, actually not recently, it's been a year now. We started last January where we went 24 hours. So we've been doing it for a year. So we are mobile all the time now. And we serve youth up to the age of 18, and we will see them over the age of 18 if they are in a school setting, and we can respond there as well. Next slide, please.
Hi again, I'm Brittni. I didn't say hi before. Thanks for having us today. So who can receive mobile crisis services? Rosa kind of spoke to this a little bit. You will see as Rosa and I do this presentation, we may get ahead of ourselves a little bit because we, live and breathe mobile crisis. So we tend to just keep going, right? So mobile crisis, we can serve, again, 17 and under, and then 18 if they're still in school. If they are 18 in the community, we will have to tap in adult crisis. we like to say in mobile crisis that we do not define what a crisis is. So whatever the family or the school or the community person that's calling it in deems a crisis, we will support. So that can be anywhere. We've done assessments in the community, in parks or at like a Dunkin' Donuts if there's privacy or something like that. Sometimes we've gotten called out to Kohl's in the past. So we really go anywhere, and we make sure that we can go out and support the child and the family for whatever their mental or behavioral health crisis is.
Can I jump in 1 second and also mention that if in a school setting, one of the things that has been unique about mobile crisis teams is they have also been able to support staff in the school with managing crises for youth as well. And Brittni and Rosa, I don't know if you want to speak about that a little bit, but I think that that's a unique way of utilizing the mobile crisis services with some, potential in the school settings.
Yeah, so I think in the upcoming slides, we'll get into kind of the different responses that mobile crisis can have. And within that, we can kind of elaborate a little more what that might look like for a school professional and the different ways that they can request how we're responding to the school.
Next slide, please.
So for mobile crisis in 2023, there were 16,322 calls to 211 and 12,427 episodes of care for mobile crisis. Call volume and episode volume did decrease compared to the following year in 2022. However, compared to 2020, when COVID happened, we are seeing the increase come back a little bit. So we're hoping to be able to get those numbers back up there from pre-pandemic times to really support the community the way that we were before. So 431 episodes of care have come in during the expanded hours that began last January, which is great, showing that we are being used with the expansion. So that is helpful to know. Next slide, please.
So this is kind of what Rosa was speaking about, when to call mobile crisis. Like I said, we do not define a crisis. So if any school settings specifically, we say like, you can always just call 211. You don't need to really even request for us to come out at first. If you just want to bounce some ideas off of us or, bounce a certain scenario off, if there's a client that you've called in a bunch of times and it's to the same presenting problem, or you guys are really struggling with coming up with a game plan, kind of like what Stephanie is, we can be utilized as a resource to help with, any additional ideas or suggestions that may have not come up. Or sometimes I think it's helpful when schools are able to call and kind of confirm what they've already thought, right? Like that they've gone through all the things that they need to go to, and we're kind of just like seconding that and saying like, yes, that's exactly what we would have done. That's what we would have suggested. So you can call 211 for a mobile crisis. For a child that threatens suicide, is a risk of violence, has been recently victimized or traumatized, that there's harm likely to occur without immediate assistance. The child is behaviorally acting out or out of control. So sometimes you'll see that amongst, a lot of the younger kiddos, I would say, that are having some sort of like impulsive reaction. A child that is in distress or is not communicating, child is depressed and you're currently worried about them, or the child is having any other behavioral health crisis. So really anything that you guys are seeing or struggling with in the school setting, mobile crisis can get called on. You can go to the next slide.
So how do you access mobile crisis services? The easiest way is to dial 211 on any phone, and then at the prompt, it's going to say press 1 for crisis, and then at the next prompt, it's going to say to press 1 again for mobile crisis. And I believe it actually specifically says for a youth in crisis. So that is the quickest and easy way to get to us. If somehow you miss the prompt and you end up pressing another number, it will delay you getting to us, but the call specialist that you connect to through 211, which is the United Way, will be able to reroute you at some point once they understand the reason for the call. But the quickest way to get to us is by pressing 1 and then 1 again once you call in through 211. And mobile crisis can also be accessed by dialing the new 988 number, which is the National Suicide Prevention Line. So you can also utilize that, and families as well, if they, happen to see the billboard or any information about the 988 line, it will redirect them to us. Next slide, please.
Some of our goals for mobile crisis that we adhere to from the state of Connecticut and with all of our goals that we have is that one of them is be highly mobile. So that means that we are going to be going out to see every client that gets called in if that's what they're looking for. Rosa has been here a little bit longer than me, but ever since I've been with Mobile Crisis, I do not know a time that we have never made mobility, or at least our percentage, maybe during COVID, but we are pretty good. Like, we make sure that we go out every time it gets called in. And the other one is to be responsive. So we are emergent, but we do arrive with 45 minutes or less. So sometimes that can be a little bit longer if it can be, depending on where we are. Specifically with Wellmore, we have a really, really large catchment. So some of our towns are outside of our 45-minute window, even if we were to leave the second we got the call. So sometimes that does happen, but we do, a part of our process and our training that we complete with all of our staff is once we get all the information for demographic, it's safe for us to go. We literally get up and go. Everybody's ready. And we don't delay. It's not like we're, stopping at Dunkin' Donuts on the way or something like that. We are very responsive when we do try to get there as fast as possible. And then we also let everybody know that if something becomes emergent during the time that we are there, then you can always utilize 911. So that way it's more immediate, but we will still be on our way. So we can still kind of work with whoever gets called out there. If you need someone to maintain safety while you wait for a clinician, but we still can complete the assessment in conjunction to whatever you need. But obviously the client safety is number one. We have convenient hours now that we're 24 hours a day, 7 days a week, every holiday. So if you ever need us, you can, call us and we're going to be able to go out. High volume, so reach all in need. So we do have a high volume, but we do reach everybody that we are meant to contact. And all of our clinicians do make an attempt to be able to complete the assessments that come in. We do promote widespread community awareness that a rapid clinical crisis response is available. So we do go out in the community. That's kind of why Rosa and I will skip ahead a little bit, is because we are always doing outreaches or some sort of community response where we are trying to get the message out, help with knowledge, answer a lot of questions. So we kind of talk about this all day and then we work in it all day. So we are always willing to support and promote widespread community awareness. And we are always looking for, schools as they come up for us to go out and kind of share what we do.
I'm just looking at the chat too, and I'm just seeing some of the feeds that are going. So, just kind of circling back a little bit, just for maybe anyone who has not used Mobile Crisis before. So Mobile Crisis is a statewide program that is available to anyone. Schools use us frequently for youth that maybe have expressed suicidal ideation or any of the other reasons that kind of Brittni listed before. We don't define the crisis if you're needing support. And so when we come out, we do a highly comprehensive diagnostic evaluation and with a high focus on high risk assessment to maintain safety within the community. So the schools utilize us a lot to provide that support, come in and assess for high risk to see if a safety plan can be completed to support that youth in that setting, whether it's to maintain staying in school or if we need to look for other resources in that moment to support that youth in being safe. We have a 45-minute window, like Brittni has expressed. At times, if a provider can't get there within 45 minutes, we're usually in contact with the school, letting them know we have several clinicians out in the field, but we will get there as soon as we can. And different agencies hold different grants throughout the state. So for Wellmore Behavioral Health, we are on the northwestern side of the state. We cover 42 towns, but there is Clifford Beers, I believe Wheeler is another one, and there's a few other agencies that have hubs throughout the state so that the whole state is covered, and that provider is the one that will respond within that catchment area for your certain school district.
It looks like, Jean, you said how many are active. Can you clarify what you mean by that? What I think you're asking is how many of our teams are active, but the entire state is 24 hours. So they respond 24 hours a day, 7 days a week. So if you call mobile crisis, you're going to get someone that's going to come out and be able to complete the full assessment.
Ms. Baldino just answered my question with that. Yes.
Okay, I just wanted to make sure. Diane, can you please clarify if parent permission needs to be obtained before you can assess work with a child? So I'll answer that, Rosa. What we do is we do not need parent permission for us to go out to the school. So we're going to be able to go out to the school to support. However, we do inform our schools that you should be contacting the parent to let them know that 211 is called, because we are a free and voluntary program. So we're grant funded. So a part of that is that the parents do have a right to decline a mobile crisis assessment. Part of crisis is nobody's going to be able to utilize something in crisis if they're being forced to do it. They're not going to participate. They're not going to be forthcoming, and it may cause further issues in terms of like giving recommendations if we have to send them to the hospital or things like that. So our suggestion, you're going to get a mobile crisis clinician to come out regardless, but what you will see is that our clinicians will say, hey, did you reach out to the parent to let them know we're going to be on our way? But if you can call the parent in between, or a lot of schools call before they go, just to give the parents a heads up. So we still say you have to let the parent know. The parent needs to be aware and that they have a choice to decline if they need to, but we're going to come out even if you can't get a hold of them. So, or even if you didn't call them yet, but you will probably hear one of our clinicians mention, hey, you got to reach out to them.
And if I can also add to that, part of that is also because we don't want to delay, right? We know that sometimes getting a hold of parents can take a little bit of time. So mobile crisis teams will be deployed out to the school while that kind of communication is happening. Now, if they get there and the parent has said, you know what, I don't really want this to happen, then mobile crisis can kind of divert their attention a little bit to kind of support those who may have been involved, whether that be the staff, right? So let me check in with the staff. How are you doing? What might you need to better manage the youth in the future? What was going on? So they can kind of adjust if that child specifically, the parent has said, no, I don't want to give parental permission for that child to be assessed.
Yeah, so that is something that we do often, as Stephanie mentioned, is we'll try to support the school, being respectful that the family has declined, but kind of providing guidance around, I think, 911 may be warranted at this time. That would be something we might suggest that you continue to do at this time due to just kind of what we've been made aware of. Or we might say, here's a list of resources that might be helpful based on the situation, and those are kinds of things. And that's part of, I think the wonderful thing about mobile crisis is that we can be so flexible in how we respond because, we don't have, like a black and white rule about what crisis is and you should do this for this and this for that. So there's this flexibility built in with the program and the flexibility that we can provide follow-up for the families afterwards too. So it allows us to support in many different ways.
I also see that it looks like Kenneth, but I see Stephanie, you responded too, but I could briefly talk about how mobile crisis can support in that way. So proactive support or anything that you guys currently have in place where we can refer and get support. So we'll talk a little bit about different ways that you can call in through 211 so you can be proactive for students that, need help. So that's where we kind of said in the beginning that if you're kind of seeing that this client is going maybe a little bit more down a depressive route, like they're starting to not want to kind of be involved in school activities, they're kind of being a little bit more like close to the chest, or they're having these big feelings, you can call 211 or speak to the parent, obviously, and call 211 and have us go out. I'm getting feedback somewhere. Can you hear me or no? Okay. So you can call and we can kind of help support the family on the backside. So we can kind of call the family, do an assessment and say, this so-and-so said that, you've been seemingly struggling recently. Like, let's try to help support. We can see if they're connected to services, get them connected to services. And that's something that we do outside of the crisis. So sometimes I guess you can say in regards to, say you call 911, you get a police officer, you get an EMT that comes out. They're dealing with the crisis right then and there. And not very often are they going to be doing things on the back burner or later afterwards. In terms of mobile crisis, we can go out and we do initial assessment for the crisis that's at hand, but we also provide follow-up up to 45 days after the crisis with the family to get them connected to services, get them to a higher level of care if needed. So we do a lot of stuff outside of like that 911 or just the crisis at hand. We deal with the crisis at hand, but we can still do the other stuff as well for whatever the family needs. And it can be proactive. You don't necessarily need to have a client in crisis, like in current crisis, for you to call it in through 211. We can help support with anything. Even, for example, we've had school counselors call or school psychs call and say, hey, I have this list of like 20 different people that I usually recommend to my families. They're all booked. I have nobody else. Do you have any idea of other places? And then sometimes that can be a phone call we can help support with, or you can send them over to us and we can kind of help facilitate that. Hopefully that answered that question for you. And then Stephanie, you can answer more.
Yeah, and I just want to reiterate too that when we're talking about crisis, right, and I put that in quotations because that's really self-defined, right? I think, Brittni, you had mentioned this earlier, that it really depends on how that person is defining that crisis. That family can kind of define what crisis means. There was a question that came to me that says, when is it a crisis enough to call 211? And it really depends. You all know your students very well. And so if you know that there's a student who escalates, right, and you're seeing all the little red flags that are going on, and you're like, you know what, 3 times this month this has happened, it's escalated to a point where it's created a big crisis, you can call at that point when you kind of know that things are escalating. It really depends on the student, on the situation, but there's also conversation that can be happening with the dispatcher, right? And I call them dispatcher, but the United Way call center folks. So you can call and say, here's the situation, here's what's happening, and they'll kind of ask questions to sort of figure out what is needed. And I see then the question about 211 for non-urgent situations. So absolutely, you can call 211. So 211, right, is our info line. But when you call, it'll prompt you to dial 1 and then 1 to reach out to mobile crisis. There can be some conversation, and they'll determine most of the time if somebody is saying, yes, I want somebody, to come out to meet me where I'm at. But if you're having a conversation, they can also give you ideas for resources and connect you to other information, because 211 also is the info line as well.
And
I hope that answers your question.
211 for non-urgent situations. That's kind of what I was just speaking to just a little bit about. We do not define it. So you may think it's non-urgent, but like if you just have a client that is struggling to get connected to services, or it's just struggling, but like they're not an immediate risk, or they're not an imminent risk to themselves or anybody else, or, there's really nothing going on, you can still call. You can call, you can talk to us. You can even just say, hey, I want to talk to a clinician first, and then say, hey, this is the scenario I have. What are you guys thinking? Do you think an assessment is worth it? or not. And sometimes even when families call, not school personnel, but even when families call, sometimes families will call for advice, and we can be like, you know what, based on what you're saying, it sounds like we probably could benefit from an assessment, or no, here's what you're looking for. You needed 5 resources in your community. We looked them up. We're able to help you. So we can kind of take it from there. It's always a phone call. We can always upgrade it to a mobile where we can go out. We can always schedule to go out at a later time, or we could just help you with what you need, the answers to your questions, but we can always adjust it as needed. And they're really, I hear that all the time with schools. Many times when we do outreaches, that's the thing. Well, when is it supposed to call 211, or when is it a crisis enough to call 211? And I tell them the same thing Stephanie said and Rosa said. There is no definition for crisis. Just call. The worst that could happen is we tell you you're doing what you're already doing, and then it's just going to give you the reprieve that you were doing the right thing. So there really is no right or wrong to call us. You can always call us, and we will just help guide you with literally whatever you have.
Also, just speaking to, like Stephanie shared, so when you call in through 211, which is the United Way, essentially, you are connected to a call specialist who is also getting training on their end of how to kind of dispatch these calls. So they are going to guide you in the best way possible as well, because they are trained to handle these situations. So as Stephanie and Brittni shared, and not to be repetitive, but, just a family calling in, they're going to say like, this sounds like you probably should talk to a clinician, and they're going to guide you in the correct way. And just on this last bullet point on this slide, Brittni had spoken to this before, that we do outreaches, and we do go out to schools very often to speak during like professional development days, or to, like the counselors or the psychiatrists in the school districts. They'll put it together where we can come out and present to them, so that we have the time to answer very detailed questions, or specific that maybe some instances have happened, and that they have specific direct questions for us. And that kind of allows for that time and space. And every agency does outreaches. It's part of our obligation in our grant contract. So you can always reach out to the local agency that covers for mobile crisis and ask that they come out to speak at your school or present during a professional development day. And that's a great way to kind of also get information out to those in your districts that might be the ones actually calling in through 211 and utilizing the service. Next slide, please. So this is kind of similar to what we were just kind of talking about, that, the 211 operator is going to connect you to that clinician over the phone. I think what's important to know, and a lot of things that come up when we are presenting, is, the school's asking, why do they ask so many questions? Why do we have to give so much information when we reach? So when you get connected to that call specialist through 211 and you're asking for whether it's non-mobile support, which is one of the ways, which is just like consulting on the phone, or mobile support, which is when we're coming out immediately within that 45-minute response, or if you're asking for like a later response, and maybe the family doesn't want us to come out to the school, but they want us to come out to the home later, that's a deferred response where we can respond out later. And those are the 3 main types of responses that we have. But when you're talking to that call specialist, they need certain information from you to get that information to us. In case the line disconnects when they're trying to connect us to you, they have that information to give to us, so that we can then reach out to you, or at least get out to the situation. So they're going to ask, name, date of birth, address, where the child is currently located, are they safe, the reason for the request, and a few other things. And if you don't have all the information, that's okay, but they do need those certain main points in order to kind of get us to be able to respond. And of course, if the line disconnects, we always want to be able to reach back out to that person to make sure that we're able to support them and get where we need to go. Let's see. Next slide, please. So this is specific. I know I mentioned a few of them before, but this will answer that question that came up in the chat, specific to the different agencies that hold the different grants. So these are all the agencies that would cover in your catchment areas for mobile crisis. And there is a catchment map. I'm not sure if it's on this, but I'm sure we can get that out to be shared as well, where it kind of breaks down the catchment areas and who that provider would be. Next slide, please.
This is just some additional resources for mobile crisis or how to prevent suicide. If you guys ever want the additional resources, we can always send this out. I don't, we have a slide. If you guys don't want to send out the entire PowerPoint, we can always send out the PowerPoint, because I think there are some pieces in here too where for Wellmore specifically, or anybody who's on the western side of Connecticut, they have our direct numbers or email, so you can reach out to us if needed. You go to the next slide.
All right. Well, thank you so much, Rosa and Brittni. I'm going to switch gears just a little bit from mobile crisis and talk a little bit about the urgent crisis centers. Next slide, please. So urgent crisis centers have been developed in response to the children's mental health crisis. We know that many youth end up going to the emergency departments when they are experiencing a mental health crisis. And we know that that's probably not the most appropriate place, either developmentally, and because they're also waiting for medical emergencies and things that are happening. So in response to some of the more mental health driven crises, in addition to mobile crisis, what Connecticut has developed are the urgent crisis centers. Next slide. So DCF contracted with 4 different agencies. 3 of them are community-based and 1 is Yale New Haven Hospital. And I talk about that one slightly differently, but we have contracted with the Village for Families and Children in Hartford, Child and Family Agency of Southeastern Connecticut, which is in like the Norwich area, and New London, and Wellmore, obviously in Waterbury. Next slide. So why the urgent crisis center? So as I said, this really stemmed from looking at our crisis system and what was happening. And we saw that one of the recommendations from the Children's Behavioral Health Plan was that we needed to explore alternative options to EDs. While mobile crisis is able to respond in the home or in the community, we know that not all families are comfortable with having somebody come into their home. And so we wanted to create a robust system that really also was responsive to the needs of our state. Next slide. There's a lot of words on there, so I'm not going to read that all for folks, but everyone will get the slides. So what we did in Connecticut was we really took the family input. We developed some short-term work groups to kind of look at what we wanted in Connecticut. And what we did was obviously expand mobile crisis. So as we heard, it is now 24/7 and has been for the last year or so. And then we also really aimed to create that alternative safe place to go. Next slide. So what we did was really in line with SAMHSA, which is the Substance Abuse and Mental Health Service Administration. I think that's what it stands for, which is the national sort of mental health agency. And the guidelines really talked about having someone to talk to, which is our 988, right? So now we have this suicide hotline, this call center that is national, so that someone can call up, talk to. Then we have someone to respond. We have our mobile crisis teams that can go to where people are and where they need the help. And now we have our urgent crisis centers, which really represents the safe place to go. Next slide. So again, as I mentioned, we have these catchment areas. So we have contracted with 4 agencies. You don't actually need to be from that location. So if a family happens to be from New Haven, but they are up in Hartford, going to some show, some event at the Excel Center, and something happens and they have a crisis and they're safe enough to go to the Village in Hartford, they're able to do that. They can go wherever is closest to them. So you don't actually have to be where you're from. So of course, the program location is in Hartford that serves the North Central catchment area. the daily service capacities, these are not bedded programs. They're sort of outpatient, right? They're not going to be like an ED or a hospital where they can stay overnight. Typically, what we're finding is that the average length of stay is about 4 hours, and it's focused on de-escalating a crisis and really coming up with an aftercare plan and following up. There's a lot of partnership that also happens between the urgent crisis centers and mobile crisis, because of course, that family is returning back into the community, going back home. And so there's going to be some coordination and making sure that families have resources and understand who they can call in an emergency. Next slide. The implementation, this is brand new. So it has been around for maybe 5 months. And it really took a bunch of people to really partner to come up and develop this and implement it. So DCF is working with the Department of Social Services to really develop program-specific billing codes, including updates to the Medicaid state plan for payment purposes. We're also working with the Department of Public Health to really identify and fine-tune some of the protocols that have been developed for ambulance transport. So what we are trying to do is really allow the ambulance to transport youth to an urgent crisis center if we know that it's a behavioral health emergency versus a medical emergency. So as of right now, all ambulance, if they have the support of their sponsor hospital, they can call an urgent crisis center and say, hey, I've got this situation. Do you have the ability to take this if I make it over there in 15 minutes? And so they're coordinating with the urgent crisis centers to bring youth directly to there. Parents have to meet them at the urgent crisis center. So the difference between mobile crisis, where they're kind of going to the situation, is that parents do have to be present because it does function slightly differently. And then, of course, we've been partnering with the Department of Education to really get the word out there, making sure that folks know of this resource because it is brand new. Next slide. And I apologize, I am talking fast because I want to make sure that we are respectful of everyone's time. Because this is new, we're really looking at how this is making an impact. So looking at the utilization, how many families have received this service, what their experience is, and what the outcomes are. Are we seeing families able to successfully stabilize and manage their crisis? And are they able to connect to the aftercare that they actually need? And in looking at this, we're also looking at the system as a whole to really identify if services need to be enhanced, if they're available, and what we need to kind of look at as we continue to make improvements to our behavioral health system as a whole. Next slide. So what will families receive if they go to the urgent crisis centers? Well, they can receive young adults, so anywhere through 18, experiencing a behavioral health crisis. So there's no appointment that's needed. They can just walk in, an ambulance can drop them off. When they get there, there's going to be a triage based on the needs of that youth and that family, and they're going to provide de-escalation and crisis stabilization. They're going to do a thorough assessment to determine what the aftercare needs to look like and make recommendations and referrals to that, and develop a crisis safety plan collaboratively with the family so that when they walk out of that urgent crisis center, they have a plan for how to move forward. They're going to provide quality care coordination. So it's not just here's the referral, goodbye, good luck, but they're going to be calling up, similar to how mobile crisis can see a family kind of up to 45 days. Urgent crisis centers are also going to be doing that follow-up to make sure that there's a warm handoff, to make sure that they're following up and that it's not just a referral, but that they're really connecting and making sure that there's communication between all service levels. And that's that bridging of services. Next slide. The UCC team is also made up of a multidisciplinary team. So they're going to be having psychiatrists who can look at some of the medications and determine if perhaps recommendations need to be made around medication management. There's going to be nurses for minor sort of medical stuff, but if there are medical needs, they really do need to be diverted elsewhere. But do have nurses there to help with some of the more minor things. There's mental health clinicians, discharge planners, family navigators, behavioral specialists, all of this to cohesively wrap the family with support to de-escalate the situation. Next slide. This is what it kind of looks like. So as you can see, there's no scary machinery like an emergency department would have. They really aimed to make them a welcoming space that is child and family friendly. There's multiple rooms. So if a family needs to be kind of separated, de-escalated kind of away from each other to give them time and space, there's that opportunity to do that. And so this is just an example of one of the agencies and how it's sort of set up. Next slide. The feedback so far has been wonderful. Families are really feeling supported, connected, relieved. They are feeling as though they don't have to wait for a very long time the way that they had in the past when they've gone to a medical emergency room. And so this is something that, you know, we have really been hearing from families that has been so needed in their opinion. Next slide. This is just kind of a quick snapshot. And again, folks are going to get this, but it kind of shows the differences between mobile crisis and the urgent crisis centers. So again, print is really tiny, but it just sort of goes through some of the details and the differences. Next slide. And again, these are the agencies. And that's all I have.
Great. Thank you so much, Stephanie, Rosa, and Brittni. We do appreciate this great presentation. We will be forwarding the PowerPoint out shortly so that everyone has the information with the resources attached. I also put quickly in the chat box that registration link again for high school affinity groups. If anyone's interested in registering, please reach out to us and let us know, or just go right ahead and register if you want. Our Talk Tuesday schedule, so it is right here for 2024. We have 9 more Talk Tuesdays, hard to believe till the end of the school year. If you want to register, just click the link, or anybody that you know that might want to register, please forward it to them and let them know. And in our information too, in case you need to contact us at any time. We thank you all for joining us today. Again, thank you, Stephanie, Rosa, and Brittni. Absolutely fabulous presentation. We can't wait to have you guys back again. Have a great day, everybody.
Thank you very